We're exploring ADHD this week because the New York Times released a great article on the diagnosis of ADHD, which is obviously so common in today's world. And essentially what the article is saying is that scientifically it's actually quite hard to tell between someone who is diagnosed with ADHD and someone who is not diagnosed with ADHD. And it's more of a spectrum of experience, attention deficit. And this is the case for many of the DSM diagnoses, where we kind of draw these lines in the sand and say this person is this thing and this person is not. It can be quite difficult with mental health to do such a thing, but insurance companies are going to try their hardest to keep doing it. But I think the moral of the story in reading this article is not to invalidate anyone's experience who has found a lot of relief in an ADHD diagnosis. There are tons of those people that I have had experience with who it has been life-changing to find that diagnosis and either work on the behavioral aspects of it or go on a form of medication. But I do think that what it can do, this sort of new perspective of ADHD being more of a spectrum of experience versus a binary thing, is it can just invite attention, like the subject, the topic of attention, into the therapy space, where I have seen that in many of my sessions, it's like as soon as the idea of attention comes up, it gets like sort of cast aside as like, oh, well, this is just my ADHD. And I think that there are real opportunities there to explore like the idea of attention and what actually happens internally when you try to bring your attention to something, because it's so core to so many other things, like this knee-jerk sort of avoidance of something, right? Like something feels hard and we bounce away from it. And it's not like so much, it's not to say there's a direct relationship between ADHD and emotional avoidance, but there is some relation that I think we have shied away from. And so I think there can be really interesting, it would be really interesting to just open up this space in therapy. Like, okay, when I'm actually trying to focus on something, when I'm trying to bring my attention to something, what happens? And that essentially is like what therapy is so often. Like, I'm noticing this thing and then we bounce and the therapist is kind of like trying to call us back to it. So I think just trying to invite like explicitly the subject of attention into the therapy space could be really fruitful and growth promoting for all of us who live in this kind of attention starved world.